Good evening. Can you all see me and hear me? Long time after which I'm coming live. So nice to see you all again. Just let me know if audio visuals all good. Hi. Hope everyone's doing well. I'm really sorry that I haven't been able to take any classes. I've been sick and have been taking a lot of offline classes, but only one is left. And after that, all of my time and energy is coming here to CR, and we're going to have a lot of classes after mid next week. My health's okay, thank you, but my voice is just gone and it's not coming back. But anyways, it'll be okay. So, I was trying to structure today's class. Uh, I thought I'll include lesions, but then when I was preparing, I thought let's just keep it core anatomy so that we can do this part, which is slightly tricky and scary upfront for JRs particularly, which is the skull base foramina. So I thought let's talk about anatomy here and navigate through that part only. And then in the next one, we'll have one more part of skull base lesions, which will be the pathologies, and then we can understand the approach. So today we'll be talking about the anatomy, anterior, middle, and posterior skull base, the foramina, and I'll be showing you a lot of cases, and we'll do some live scrolling and see how we can figure out. All right. So pay attention, and then I'm gonna ask you a few questions. All right. So let's start. When we talk about skull base, why it's so important is because it's literally the bridge between all of the facial lesions which are gonna cross over to the brain and vice versa. So the cross-sectional imaging becomes very, very vital because clinicians really don't know what to do about this area, right? So we are the only people who are going to be able to see and comment about what's happening to the lesions here. And often even pathology, so these lesions are inaccessible for biopsy. So we have to first talk about where the lesion is, localize it, and then understand where it's coming from. Is it coming from below? It's coming from up, where the epicenter is and what the localization is, right? So that's something that we have to focus on here is extent and then the pathological basis, because you are the only person who's going to be talking about the skull base lesion, right? And the ENT surgeons slash the neurosurgeons are relying on radiology here very, very heavily. That's why this becomes a very important area. And also for exam purpose, you get a lot of long cases which are skull based lesions. And I believe it's one of the toughest cases that you can get, because then your viva is going in anatomy direction for sure. They're gonna keep scrolling and asking ye kya hai, ye kya hai, ye kya hai. So we have to be very confident. So mainly the bones that we have here is going to be the frontal bone anteriorly. We have the sphenoid sinus that we are seeing. We have the petrous temporal bone, and then we have the occipital bone. So mainly it's going to be these bones that we are going to be playing with, and then we have to take it from there. All right. So there are four main sutures that you have to be aware of. So this is the sphenoid, right? So this is the sphenoid, which is shaded green. And what you have here is the squamous part of temporal bone. So this is the first suture, which is the spheno-squamous suture. Then with the petrous apex and the sphenoid, we have the petrosphenoidal fissure. Then come behind, purple is occipital. So this is the clivus here, and this is the occiput base here. So what we have here is the occipitomastoid suture, mastoid part of temporal bone, and this is petro-occipital fissure. So we have basically the temporal bone coming with and fusing with the occiput bone posteriorly and anteriorly. So these are the four sutures slash fissures, two fissures and two sutures that we gotta have in orientation of. So these are mainly the bones, and then we go into each skull base individually, right? So when we talk about the skull base, anterior, middle, and posterior, that's how any localization is going to happen. So what you see anteriorly in purple is all of your anterior skull base, right? So all of this part here in purple is our anterior skull base. Mainly in the anterior skull base, the foramina that we are going to be dealing with is going to be the foramen cecum and the cribriform plate. Then when we come to middle cranial fossa, we mainly have the sphenoid. We have the planum sphenoidal, we have the lesser wing, and this is the greater wing of sphenoid. In that, I have optic canal, superior orbital fissure, and Ross. Remember Ross, rotundum, ovale, and spinosum, right? Then coming here, there is a foramen lacerum, internal auditory meatus, and this is where I draw a line of middle cranial fossa. Behind this is our posterior cranial fossa, where we have jugular foramen, we have internal auditory meatus, which may be localized in either, better to keep it in posterior, and then we have the hypoglossal canal. So this is everything that we have to find on a CT scan and navigate on a CT scan. But I hope you guys got the idea as far as what the structural orientation is. So we got to take it in baby steps, one after the other, and find each and every structure, right? So that's what we are gonna be doing. Let's talk briefly. First, I'll go through the theory and then we'll start seeing the images after that. All right. So when we talk about anterior skull base, anteriorly we have the cribriform plate in the midline and we have the frontal bone, which is coming in anteriorly, and posteriorly is our planum sphenoidal and lesser wing of sphenoid. So this is my anterior skull base. What are the structures? So below lies the, so basically above the here lies the frontal lobe and the frontal sinuses, and below we have the orbit, ethmoidal sinus, and nasal cavity. Why this is important? Because this is what the masses are going to be. What are the masses coming in the anterior skull base? They are going to be orbital tumors extending. They are going to be ethmoidal sinus, paranasal sinus tumors coming up, or nasal cavity, something like an esthesioneuroblastoma. So this is what we need to know, that from below they come up, or from above there may be frontal meningioma which is coming, right? So it's either below it or above it. So if we know the structures, just like mediastinum, if you know what is there in the mediastinum, you can predict the pathologies. So that's why this is important. Now talking about the foramina, where you will be asked anatomy. So we have foramen cecum, which is nothing but emissary veins to the superior sagittal sinuses. So just emissary veins which are connected to the superior sagittal sinus. Cribriform plate contains the first cranial nerve, that's olfactory nerve fibers. And then we have optic canal within the lesser wing of sphenoid, which has optic nerve, which is second cranial nerve, and ophthalmic artery. What I have given you here is a checklist, that this is everything you should know as residents to identify in the CT scan. You need to know where is cribriform plate, where is crista galli, where is fovea ethmoidalis, lateral lamellae, foramen cecum, and planum sphenoidal. So this is your checklist. So let's see if you guys can tell me. So let's start off with here. Can you tell me what is the structure A? What is it that I have marked with A? Let's try and discuss this. Is the anterior skull base. Correct. This is the crista galli. So what I have at A is the crista galli, right? The bony plate that you can see is crista galli. All right. What is the structure marked B? I'll just, the arrow is a bit, this is the structure B. What is this, and this? That is B. This is the cribriform plate, right? So this here is the cribriform plate. So where the crista galli ends inferiorly, that is where the cribriform plate is going to start. So B is our cribriform plate. This is the most common site where a fracture is going to result in CSF rhinorrhea, right? Okay, look at structure C now. What is structure C? Again tell you. So it is just lateral and superior, superolateral to the cribriform plate. What is C going to be? The superolateral part of the roof. Yes. So this is the lateral lamellae, right? So this is what is the lateral lamellae that is going laterally. So lateral lamellae. And then what do you think is D? The lateral extension of lateral lamellae, which forms the roof of the ethmoidal sinus, the roof of the ethmoidal sinus, the superolateral extension of lateral lamellae. What do you think D is? That is fovea ethmoidalis. Yeah, so nobody answered that. That is fovea ethmoidalis, which is the roof. Yeah, so that is the roof of the ethmoidal sinuses. And what is this part here? E, the one which is left is what? Just point it for you. It's this. What is this? This is the perpendicular plate, right? So our nasal septum is partly bony and rest of it is cartilaginous. So it's the perpendicular plate of ethmoid that forms the bony part of the nasal septum. So that is the perpendicular plate. Fine. So this is something which is very, very crucial anatomy that we need to know, which is the anterior skull base. Fine. What do you think is this? Something which we don't really talk about or see. In fact, I have never noticed it before I was preparing this class. I have never ever looked out for this structure, but now probably I would, which is the nasal process of the front. It's the same thing, right? So this perpendicular plate is it's actually ethmoidal bone. Nasal process of frontal bone will be even anterior. Yeah. So this one probably from the frontal bone. ये तो हम ethmoid में आ गए. This one here is the nasal part of the frontal bone. Yes, so this is what is your foramen cecum through which the emissary vein is going into the superior sagittal sinus. So this one much anterior here is our foramen cecum. All right, so this is your anterior skull base that we need to know here. This part here is the planum sphenoidal, right? So when we look at planum sphenoidal, usually in the sagittal plane, this just anterior to the sella will be your planum sphenoidal. So now put a checklist. Do you know each one of these? Can you find cribriform plate? Yes. Crista galli? Yes. Fovea ethmoidalis is the lateral roof and lateral lamellae is just below it. Foramen cecum much anteriorly and planum sphenoidal sagittal. Yeah, everybody, is that a go? So anterior skull base, we are through. Let's talk about optic canal and its nearby things now. So now let's come back near the orbit. So what is this in red arrow? What is this now? This foramina or fissure or canal? Yes, this is the superior
Superior
orbital
or
fissure. So
fissure.
what you're seeing in red is the superior orbital fissure. What do you see in blue? What is this bony strut that you are seeing in blue, which is coming from this bone here and going medially near the optic canal? So medial is optic canal, lateral is superior orbital fissure. Yeah, so you may have said optic canal as well, but something like in FRCR part 1, you would have to say, because it's a bony plate, you would have to call it optic strut. Optic strut is this bone which is extending near the optic canal, all right? So what you see in blue, we will have to call it optic strut because it's a bony plate, but it's basically optic canal. And what do you see in green is nothing but the anterior clinoid process, right? So this is the anterior clinoid process. So together this area is what we call as the orbital apex. It's the medial optic canal and it's the lateral superior orbital fissure which make the orbital apex. So something like a Tolosa-Hunt syndrome will have granulation tissue involving both of these, right? So this is orbital apex syndrome. When you see enhancing granulomatous tissue here, you call it Tolosa-Hunt, or one DD would be IgG4. So those are your DDs here. So yellow is nothing, it's just the greater wing of sphenoid. Okay, now let's look at all of these in coronal plane. What do you think is blue? Again, this blue is the bony plate, right? So from green, you are seeing the anterior clinoid process, which is forming the floor of the optic canal. So in blue, again, this is the optic strut. This bone that surrounds the optic canal forms the floor of it. This is the optic strut in blue again. And now what you see in white. White में क्या है? What is this? So this one here is the optic canal, isn't it? Everybody, are you feeling okay? This is the sphenoid sinus, उसके just ऊपर. This is the optic canal. All right. So ये हो गया optic canal. And what you see in red laterally and inferiorly is your superior
Yes.
orbital fissure. Fine. So again, together, these are going to make the orbital apex. And finally, what you see in yellow is the greater wing of sphenoid. Coronal में समझ आ गया, optic canal superior orbital fissure वाला. Yes, we will talk about these two as well, but this is what is foramen rotundum, and what you see inferiorly is the Vidian canal. So foramen rotundum, Vidian canal. So from superior to inferior सबसे ऊपर होता है optic canal. उसके inferolaterally SOF, superior orbital fissure. उसके inferolaterally foramen rotundum, and उसके inferomedially is Vidian canal. So this gives you a orientation of how when I'm going to take cuts, I'm going to start seeing things. सबसे नीचे, after the pterygoid plates, I'm going to see Vidian canal. उसके ऊपर के plane पे I'm going to see foramen rotundum more laterally. उसके ऊपर के plane पे superior orbital fissure laterally, and then just at that level, optic canal. Right? So that's what we are going to see in our axial cuts. That's the order. Fine. Feeling okay? Let's come to middle skull base. Middle skull base, we start from where we ended. So we have sphenoid and temporal bones anteriorly, right? So that is what is there. Above, obviously, the temporal lobe in the middle skull base, and inferiorly, very, very important, we have pterygopalatine fossa, infratemporal fossa, and sphenoid sinus that we're going to look at. कौन से fissures and foramina देखने? Yeah, my voice is gone. I've been having back-to-back classes. I got sick in between, never really recovered. So voice is not coming back, but it'll be okay. So we have superior orbital fissure, which we already saw. Yeah, so this we have seen. Vidian canal, foramen rotundum. We also took a glimpse of that. And then we have foramen ovale and spinosum. So as far as the contents are concerned, 1 and 2 we have seen. Superior orbital fissure is everything else, right? So we have 3, 4, 6 and V1. Ophthalmic branch of trigeminal, and all of its branches are going to come from superior orbital fissure. The superior and the inferior branch of the ophthalmic vein are going to come from here. Vidian canal has Vidian nerve and artery. Foramen rotundum has maxillary. Foramen ovale is male structures that you all probably remember. So mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary veins. And foramen spinosum is foramen spinosum. No, I'm okay. Foramen spinosum is middle meningeal artery mainly, along with nervous spinosum. Okay, so these are the fossae. We'll come to our checklist in a while. Let's first see the images. All right, so let's do this. Can you tell me what is structure marked A? So just to give you an orientation, we are here at the level of the maxillary sinuses, somewhere inferiorly where the nasolacrimal ducts are just opening. Right. So pterygopalatine fossa is this. Can you tell me the medial origin of the pterygopalatine fossa? If I can give you a hint, it's also a three-letter word. This is where JNAs begin. This is the origin of juvenile nasal angiofibroma. That's enough hint. Yes. So this is sphenopalatine foramen. So SPF, sphenopalatine foramina, is this one, right? So ये पहला three-letter हो गया. Then sphenopalatine foramina extends to form this. So important. So this part here is your PPF. PPF matlab pterygopalatine fossa. Okay. And finally, laterally, what is this part? Can somebody tell me the third part now? ये कहाँ पे खुलता है? Yeah, it opens into infratemporal fossa. But what is that opening called? Again, a three-letter word. The third part of it. The opening is pterygomaxillary fissure. Pterygomaxillary fissure. If it's the first time you are hearing these words, it may seem a bit overwhelming, but in a few days, you'll be just throwing these terms around, okay? So we have SPF, PPF, pterygomaxillary fissure, which opens into the fourth part, which is infratemporal fossa. Okay, so line से ये medial lateral हो गया. अब ये पीछे कौन है? Who is this opening now? Can somebody tell me? Only one doubt. Is it Vidian canal or is it foramen rotundum? That's the only thing you have to tell me कि इन दोनों में से ये क्या है? So when it is a wider sort of a thing, when you see that it is slightly wider, this is foramen rotundum and not Vidian canal. So this is foramen rotundum. Vidian canal is say one level niche. It will come slightly narrow. When you look at it enough times, you will know. But I'll show you. So this is foramen rotundum, and this is nothing but the internal auditory canal which is leading up into the cochlea. Feeling comfortable with itna, everybody? इतना ही मेरा एम था टू ओरिएंट यू टू एसपीएफ पीपीएफ पीएमएफ in this particular section. All right. So now one step ahead. So now look at this one. Now see the difference. This is what Vidian canal looks like. It's much smaller. छोटा सा foramina होता है. So this is what Vidian canal is. So again, this has to be the pterygopalatine fissure only. But now this becomes Vidian canal. Slightly inferior level to the last one. And at this level, we begin to see our other two foramina. So can somebody tell me what is this? Oval शेप भी ओवल है, नाम भी ओवल है. So this is foramen oval, and what lies below it, छोटा सा round foramina, very difficult to miss. This is foramen spinosum. So oval and spinosum are pretty easy to be identified. And then what is this one now? This is a canal, right? Looks like a canal. So this is the carotid canal which opens medially into this lacerated part. So this is foramen lacerum. So carotid canal extends into the foramen lacerum. So foramen lacerum is a better answer here, right? So this is about these. Are you feeling comfortable with this much, right? All right, then tell me all of these. What is A? Quiz. What is A now? Again, anytime you see pterygoid plates and you see the maxillary sinus, this is pterygopalatine fissure. Thank you. I never thought I will be responsible for making anybody's anatomy better, let alone my own. But I'm glad I can help. So this is pterygopalatine fissure. What is B? Shape se pata lag raha hai. What is B? B is foramen ovale. Yes. Okay. What is C? What is C now? Whenever you see this longitudinal thing, very good. C for carotid canal. What is D? D is the middle ear. Can you tell me which bone has been marked if I ask you in particular? So this is the ice cream cone appearance. Ice cream cone is formed by malleus and incus. So head is malleus and cone is incus. So yeah, it is incus, or maybe you can say malleoincudal joint. But head ice cream is malleus and cone is incus, right? So that's the middle ear. G jo dikh raha hai is the cochlea, right? So we see the cochlea here. Then what do you see at F? F is the fissure, right? It's the fissure between what two bones? This is clivus and this is the petrous apex. So this is the petroclival synchondrosis is what it's called. So this is the petroclival synchondrosis. E reh gaya. What is E? Anybody can tell me what is E? So this is how the facial canal is going to run, right? So the posterior wall of the middle ear, and this is where it opens. Yeah. Yeah, I'm gonna show DICOM images also. Abhi, I'm just building up. We're gonna see loads of DICOM images that in the end you'll be like, ma'am, please don't show us any more skull base. We are clear. So till then, I'm going to show you. So what you see in E here is the facial canal, right? So that's the facial canal in the middle ear, which is the stylomastoid foramina, which if I just continue, it's going to become stylomastoid foramen. And H is nothing but the sigmoid sinus, the fossa for sigmoid sinus. All right. Feeling okay? All right. We will build it up. You will revise. It will get better. Another coronal view to show the same. So we are seeing the optic strut. So this becomes optic canal. This becomes superior orbital fissure. We are seeing the Vidian canal here. This is the Vidian canal that you are seeing here. And these are the pterygoid plates. Okay. So this is what you had to know here in this image. Right, let's put a checklist if we know the things here. Tuberculum sellae. Didn't show you tuberculum sellae and sella turcica because these were images which were not at that plane, but I will show these to you in our DICOM image. Pterygopalatine we know. Foramen rotundum we know. Vidian canal we know. ovale and spinosum, anterior clinoid, optic canal, SOF, carotid canal, foramen lacerum. Do these terms sound okay now? Yes, that we can identify them. All right.